What should we remember when giving first aid? In this video, we cover the topic of the things you should remember when giving first aid and thus help and even save life in the case of an emergency. However, I strongly recommend that you visit our site and read the full article on the subject so you'll be prepared for every possible situation that may arise. Enjoy our video. Accidents and injuries happen, and when they do, it's important to be prepared to deal with them. That's why knowing some basic first aid is so important. It can literally mean the difference between life and death. First aid is the initial care given to a person who has been injured or who is in sudden ill health. It can even be provided by someone with no medical training. It can make all the difference until professional help arrives. How to give CPR. When giving CPR, it's important to remember to 1. Check the scene for safety before approaching the victim. If the scene is unsafe, do not enter it. 2. Call 911 or your local emergency number if the victim is unresponsive and you are alone. If someone else is with you, have them call while you begin CPR. 3. Begin chest compressions by placing your hands in the center of the victim's chest, interlocking your fingers. Use your body weight to perform compression-only CPR at a rate of 100 to 120 compressions per minute. Avoid tilting the head back, as this can cause air to enter the stomach instead of lungs. 4. Continue compressions until help arrives or the victim begins to show signs of life, such as coughing, moving, or opening their eyes. How to help a person who is choking. If someone is choking, it is important to act quickly and remain calm. Try to encourage the person to cough. If the person cannot cough, cry, or speak, then they are having an obstruction in their airway, and you will need to perform first aid. There are 2 ways to help a choking person: abdominal thrusts, Omnic maneuver, and chest compressions. The Omnic maneuver is used when the obstruction is partially blocking the windpipe. To do this, stand behind the person and wrap your arms around their waistline. Make a fist with one hand and place it just above the person's navel. Grasp your fist with your other hand and give quick upward thrusts until you dislodge the object, causing the blockage. If you are unable to do abdominal thrusts, or if they are not effective, then begin chest compressions. Place both hands on top of each other in the center of the chest and push down hard at least 2 inches 30 times per minute until emergency medical help arrives or the victim becomes unresponsive. How to help a person who is having a seizure. If you see someone having a seizure, it is important to stay calm and follow these steps. 1. Do not try to hold the person down or stop their movements. 2. Clear the area around the person of any hard or sharp objects. 3. Put something soft under their head. 4. Loosen any tight clothing around their neck. 5. Do not try to give them anything to eat or drink. 6. Turn them on their side so they do not choke on vomit or saliva. What you should do if someone is bleeding. If someone is bleeding, the first thing you should do is apply direct pressure to the wound. If the bleeding is coming from an extremity, elevate the limb above heart level. If possible, have the person lie down and rest. Once direct pressure has been applied, look for any foreign objects in the wound and remove them if possible. If the bleeding does not stop for 10 minutes of direct pressure, seek medical attention immediately. If the bleeding is severe, you may need to apply a tourniquet. Here's how to apply it to stop bleeding. 1. Place the tourniquet around the limb above the wound. 2. Tie the tourniquet tightly, making sure it is not too loose or too tight. 3. If possible, twist or wind the tourniquet until bleeding stops. 4. Once bleeding has stopped, secure the tourniquet in place and do not remove it until medical help arrives. How to treat burns. Burns are one of the most common injuries that people sustain. While most burns can be treated at home, more serious ones require medical attention. Burns can be classified as either first, second, or third degree, depending on how deep they go into the skin. First degree burns only affect the outer layer of skin and are generally not too serious. If you or someone else have a first degree burn, hold the affected area under cool running water for at least 5 minutes or until the pain subsides. You can then apply a topical antibiotic ointment if desired. Second degree burns extend deeper into the skin and can cause blistering. For a second-degree burn, also hold the affected area under cool running water for 5 minutes before applying an antibiotic ointment and wrapping it in a sterile gauze bandage. Third-degree burns are the most severe, damaging all layers of skin and often causing tissue damage as well. If someone has a third-degree burn, do not try to remove any clothing that is stuck to the burn area. Instead, cover it with a clean sheet or towel and seek medical attention immediately. Do not use ice, butter, petroleum jelly, or any other home remedy on any type of burn. This can actually make things worse. Be sure to follow up with the doctor if there are any concerns about the healing process or if new symptoms appear. How to treat sprains. There are a few things to remember when treating sprains. 1. Rest the injured area. This will help minimize swelling and pain. 2. Apply ice or cold packs to the injured area for 20 minutes at a time, several times per day. Do not apply ice directly to the skin. Wrap it in a towel first. 3. Elevate the injured limb above heart level to help reduce swelling. 4. Use over-the-counter pain relievers like ibuprofen to help relieve pain and inflammation. How to treat a heat stroke. Heat stroke is a condition caused by body overheating, which can damage the brain and other vital organs. Symptoms of heat stroke include headache, dizziness, nausea, confusion, irritability, and unconsciousness. If someone is suffering from heat stroke, it is important to take immediate action. Here are some steps to take until help arrives. 1. Remove the person from the hot environment and into a cool, shady area. 2. Cool the person down with whatever means available, fanning them, spraying them with cool water, or covering them with damp towels. 3. Have the person drink small sips of cool water if they are able to do so without vomiting. 4. Monitor their vital signs and keep them comfortable while waiting for medical assistance. How to treat hypothermia. Hypothermia occurs when the body temperature drops below 95 degrees Fahrenheit and can be life-threatening if not treated immediately. Symptoms of hypothermia include shivering, slurred speech, confusion, and drowsiness. If someone you are with begins to exhibit these symptoms, it is important to take actions right away. 1. To treat hypothermia, start by getting the person out of the cold environment and into a warm room or shelter. 2. Remove any wet clothing and replace it with dry blankets or warm clothes. 3. Give the person warm drinks, do not give them alcohol, and share your own body heat by snuggling close in bed or under a blanket. 4. If possible, warm up their hands and feet using hot water bottles or immersion in warm water up to 104 degrees Fahrenheit. 5. Seek medical attention as soon as possible. How to treat fractures and broken bones. There are different types of fractures, but the most common is a break in the bone. It can happen from an injury or from something else, like osteoporosis. A fracture needs to be treated by a doctor so it can heal properly. If you think someone has a fracture, it is important to seek medical attention as soon as possible. In the meantime, there are some things you can do to help. 1. First, try to keep the person calm and comfortable. If they are in pain, give them over-the-counter pain medication, ibuprofen, that was mentioned earlier. You can also apply ice to the area to help with swelling and pain. 2. Next, it is important to immobilize the injured limb or joint. This will help prevent further injury and relieve pain. Splinting is one way to do this. You can use anything that is firm and straight, like a stick or ruler, to splint the area by tying it on either side of the injury using strips of cloth or gauze pads. Once splinted, be sure not to adjust it without consulting the doctor first. 3. Finally, elevate the injured area if possible so it is above heart level. This will also help reduce swelling caused by gravity pulling fluid into the affected area. When the injured person gets to the hospital, the doctor will take X-rays to figure out how bad the fracture is and what kind of treatment is needed. They may put a cast on it or do surgery. With proper treatment, most fractures will heal completely within 6 to 8 weeks. Thank you for watching. If you enjoyed our video, please like it and subscribe to support our channel. For the full article and more information about off-grid living, survival, camping, and much more, Please visit our site and enjoy our articles on these and other topics. Have an amazing day.